Hello again, Dr. Keith Grimes, the VR Doctor, back for day 3 to investigate the role of virtual reality in consulting with patients. And today, we're going to deal with one of these common problems that I get all the time. Do you forget what the doctor has said to you after you've left the room? And how can VR help that? So, I'm back in my consulting room. You can see all the kit down here. And I'll start by just saying that doctors already, general practitioners, family practitioners, and all doctors work really hard to try and help patients understand what they're trying to put across, to come to a common understanding, and to remember some of the information afterwards. And we do so by trying to speak in a shared language to understand the patient's understanding of things, to keep things concise, repeat them, maybe hand out information afterwards. But sometimes because of time pressures, we don't do this so well. Maybe we don't do this too well anyway, or maybe when you're speaking to a patient, you're delivering bad news, or they're distracted as well and they can't remember. Or maybe they've got memory problems. So how do you recall what's happened? Well, there's already many people trying things like recording. I have patients come in who ask to audio record things, and that's fine by me. I like to be able to consent to that sort of thing. But what about video recording? I often think that it'd be quite useful to have something like Amazon Alexa or a similar device, if you could handle the security on the desk, and then you could record the totality of the audio of the consultation and then attach it to the record, and maybe even send it on to the patient to aid recollection and save time for doctors writing little pieces of paper and the like. But we're talking about VR here, so what's possible in this space? Well, for a start, I'm recording this consultation anyway. I'm speaking to you. And so I could have this information sent on to them. Now, that's a very flat representation of what, to me, is a 360-degree world. So, how could this be beneficial? Well, the first thing could be that the patient could come into virtual reality with me. And if I bring up the table here, you can see in the background, there's space on this table for 3 other people. Now, at present, the barrier is a little high. You have to have Oculus Rift and some touch hand controllers. But being present inside here would allow you to record it, again, using this, and have the patient inside so you can recall your own words, what you said and what the doctor said in return, and maybe look at some of the objects that you may be using. Perhaps the doctor drew a diagram of an ear that you wanted to have a look at, understand a little bit more about what happens when you've got an ear infection. It's a very strange looking ear. Sorry about that. Or, if the technology improved, why not capture the totality of what we're doing inside here? So you can step back into it and watch it again, or maybe watch it from a different space. And you can go even further than that as well. Maybe by going back into this, you want to cement some ideas, and so you might change some of the environment. Maybe you went in and you would like to make the doctor look slightly more ridiculous or interesting to help cement it in your mind. Or maybe you just prefer a doctor that has... what are we looking for here? A beard, like this. This is my little background here. You can utilize the entire space to try and memorize things. Or maybe the doctor's room is just too generic for you, and what you might want to do is just visit somewhere different. And this is the default setting, a nice park. And that way you can utilize your spatial memory and your physical memory to cement those ideas as well, and then record them and come back. So virtual reality offers an enormous amount of useful hardware and software to alter a person's reality, alter a shared reality, and allow people to remember or even record and revisit. And then we're not even looking at the situation where I might be able to speak and have what I'm saying automatically translated to the patient. Or maybe we can hear and see different things. Now that's an asynchronous environment as far as I see it, and that's the topic of what I'm going to look into tomorrow. So for now, I'm just going to say, please join us on VR Doctors on Facebook. It's very easy. It's very welcoming. You can come and discuss all these ideas and maybe tell me what you think I should be looking at. Alternatively, you can follow me on Twitter. It's @KeithRhymes. And the final thing I'm going to say is I'm terribly excited just now because later on today, I am going to be traveling to see my friend Manish Juneja. Now, I've got a little selection of pictures up here. Let me have a look here and see if I can find a picture of me and my friend Manish. Here we go. Well, that's not it. Let's try this again. There's the fella. This is making for really interesting viewing, I can tell. I won't say it just now. I'm seeing Manish Juneja a little bit later on, and we're going to be traveling down to the southeast to see an Academic Health and Science Network event, a digital health road trip, and maybe even traveling inside an autonomous vehicle to talk about healthy mobility. But for now, it's goodbye from me, and we'll see you again tomorrow.